We're coming up on the time of year when a lot of people are eating a lot of candy because it's out there. And I don't know about you, but whenever I eat a lot of candy, I oftentimes get a little canker sore in my mouth, and it tends to hurt like the devil and goes away, after a couple days. But there are those cases, and I'm sure you've thought about this, where you don't know if it's something more serious. And there's a huge, huge concern that you should take if you do have something wrong with your mouth. And we're going to talk right now with Dr. Youssef Obeid, the director of Obeid Dental in Chevy Chase, about what you need to look for when problems in the mouth turn out to be something much more serious. Doctor, thank you very much for joining us today. Those little white canker sores, they do hurt like the devil, and everybody gets them. And I'm sure everybody thinks, maybe this is something serious. Should you go see a dentist when you get one?
Well, it usually lasts for a week, and there is an old say for it. If you treat it, it will take a week, and if you leave it alone, it will take 7 days. Those things tends to heal by themselves. You just want to, go around the symptoms and, treat it.
But if it lasted for more than a week, that would be cause for concern.
Yes, anything that lasts for more than 2 weeks, it's something that you would like to investigate, and that's what we usually tell of our patients. Especially right now with the scare of oral cancers and things like this, we really want to make sure that if you have any lesions, any white spots, any red spots that you find in your mouth that last more than 2 weeks, that's something that will raise the alarm, and then go ahead and have a check.
Now, normally, these kinds of things, these kinds of cancers of the mouth, are associated with heavy drinking and heavy smoking, are they not?
Well, let's talk statistic for a little bit.
Okay.
There is, right now in the U.S., we have 34,000 people who get affected by oral and pharyngeal cancer every year. That's one patients per hour who will die from oral cancer 24 hours a day. So that's a lot of people who are dying from oral cancer.
And these are unusually gruesome kinds of deaths. I hate to be graphic about this.
It's exactly true. And it's not because it's difficult to treat, Doc, because it's usually get to be discovered late. When the cancers start to get bigger and metastasize, which is the word that we use for cancer who goes from one area to the other, then it really will become hard to treat, and it's a bad healing.
I had an uncle who died from oral esophageal cancer, and not to be too graphic about this, but I think it's a fair warning for people out there. A lot of people know my Uncle John, who was a Star newspaper in town, and he started getting a hoarse voice one day, sore throat, went to the doctor, had cancer, had his voice box taken out, and had one of those things that you talk into. And over several years it regrew, and he had to have his tongue taken out. It was a miserable, gruesome kind of death. So, and if it's a warning for somebody to stop smoking or to stop drinking, that was it. It sent a very, very clear message.
Well, here's the other things, Doc, that I think you and the viewers will find very interesting. That in the last couple of years, what we're finding is that the way and the cancer awareness of people has started to increase, which is very good. But the number of your regular persons who used to get cancer, you used to think of old people who smoke a lot and drink a lot, but that's not the case anymore. We start seeing, first of all, a lot of women who are starting to catch up to men. We start seeing a lot of cases of oral cancer in women. That's on the rise.
These are not necessarily smokers or drinkers.
Well, that's not. We'll talk about it in a second. But yes, you will see. Women tends to react less favorably to smoking and to alcohol. So if you're a woman who smoke and drink, your chances to get oral cancer is much higher than men. You're just more susceptible in your body to get that. What we also start seeing the rise is in oral cancer in young populations who didn't smoke and didn't drink. That's the scary statistics that we're starting to face as professionals.
And what is the suggestion about what's causing this? What's the causation?
It's still a little difficult to find out, but we're finding that there is a high correlations between the HPV virus, which is
human papilloma virus.
Exactly, the ones that you find it in the genitalial tract of females.
So this comes from having oral sex?
That's what we are worried about. Yes, and again, we start seeing that happening with young people, age 13, 14, start to having sexual relationships, and they just, we don't know. Next thing you know, if you have a 25, 30-year-old patient in your dental chair, he comes in to have teeth whitening, and you find a lesion, and it's hard for you, to one day to tell a 30-year-old patient that he have cancer.
Yes.
It's something else if you have 60-year-old or 70-year-olds that smoke all his life and then develop an oral cancer.
Yeah.
But that's why we try to let everybody know is that we want them to go and see the dentist twice a year, get their annual check, look for cavities, but also look for oral cancer.
Right. Let's talk about some of the warning signs again. We talked about the white canker sore that may last longer than a week or two. That's a warning sign. What are some others?
That's very good cardinal signs, because you want to try to catch this right at the beginning. So, if get familiar with your mouth, look and see, and if you start seeing anything that is out of the ordinary, like those spots that last, then come and let us check it. Also, what you can find is some soreness, like a cold soreness in your throats. You'll have coughing. There was dry cough. You might have some swelling, in your lymph node right here that you cannot explain, and it lasts also for a long time. You can also have, in some advanced cases, difficulty in moving your tongue. Difficulty in swallowing, horsey voice like what your relatives had. Those are symptoms that usually happens toward the more advanced cases. But it doesn't matter. If you feel this, just come on in and let us check it.
These things are easily treatable if they're caught early, correct?
If they're caught early, it's easy. The more that you have that cancer going on, the harder it will become to treat, because, like you said, surgery to treat it, it's more aggressive now. Even now, we did not improve so much on surgery. You still have to go through aggressive surgery, and we take a lot of extra tissue with the cancer, so it's hard. It's a hard one to treat.
Dr. Obeid, we're basically out of time. Real quickly, though, I see a lot of young kids dipping snuff, especially boys, and that's a terrible
all tobacco
thing, right?
product, chewing, smoking, drinking, heavily, all that as a contributing factor to oral cancer.
Dr. Youssef Obeid, thank you so much for your
welcome.
information. We really appreciate it.
You're quite welcome.
Thank you. Coming up.